decision about your future. I think someone is not on mute. We can hear some disturbances. Perfectly fine. No disturbances now. All right. So I'm Aniket Arora, your moderator for today, and I want to take a moment to thank all of you for being here. And I want to say that your presence and enthusiasm truly makes this session impactful and enriching. Now let's dive into our exciting session. This session will help us unravel differences between a psychologist and a psychiatrist. And to shed light on incredible opportunities within this field, we have an extraordinary guest with us today. So allow me to introduce Dr. Dhruv Thakur, a name synonymous with excellence in mental health care. Dr. Dhruv Thakur is a distinguished gold medalist psychiatrist with over a decade of experience. His expertise spans across a range of mental health challenges, including insomnia, anxiety, depression, and other disorders. He is a certified specialist in cognitive behavioral therapy and for insomnia, CBTI, offering personalized care to improve mental health well-being. But that's not all. Dr. Dhruv Thakur also shines as a corporate wellness trainer, conducting workshops on mental health, stress management, and productivity for leading organizations. In addition, he's an entrepreneur, championing herbal wellness through his venture, Plantism, and an advocate for mental health awareness through his research on innovative EPIC productivity coaching program. So let's give Dr. Thakur a virtual round of applause.
Thank you so much, Aniket. Thank you. Hi, everybody.
Hello, sir. How are you?
I'm good. Thank you. I hope everybody is doing well as well.
Yes, sir. I just want to say that the students are on mute, and in case if you want to interact with them, we'll ask them to raise their hands, and we can pick up them by their names.
That is perfect. Could they be comfortable writing anything in the chat as well?
Definitely, they'll be. To be honest, our students are more comfortable in writing chat in the chat. They're not very friendly with the virtual. They don't want to show their faces.
That is fine.
So,
That is
so for anyone new to our platform, I would like to introduce CAMP, the Knowledge and Awareness Mapping Platform. CAMP is an initiative of the CSIR NISPER dedicated to bridging the gap between education and real life application. Our mission is to cultivate a scientific mindset among students while nurturing their hidden talents. So, beyond online sessions, CAMP also organizes quiz competitions and exciting scientific excursions to places like CSIR, ISRO, and DRDO, allowing you to explore science in real world settings. If you're interested in these excursions, check out the link in the chat for more info or reach out via the helpline numbers. Now, without further delay, let's welcome Dr. Dhruv. So, sir, the stage is all yours. And to the participant, I would love to say that please stay engaged. Use the chat for comments and feel free to raise questions during the session. This is your time. This is a great opportunity. Try to interact, try to engage, learn as much as you can. So please.
Hello, everyone. Thank you, Aniket, for such a kind introduction,
Thanks.
for inviting me here, for giving me an opportunity to interact with such lovely students. Thank you. Um I would love to talk about psychology and psychiatry as a career option, and I would love to interact with the students on this. So I would like to ask the students who. So I'll ask the question, and you have to write the answer in the chat. Okay, a very simple question for all of you. Who here is interested in psychology as a subject? You can write I in the chat. If you think psychology is interesting, it sounds very interesting, you can write I in the chat. Okay, okay. I'm getting a lot of eyes here. Okay, I'm seeing all of that coming as a direct message. Okay, okay, okay. Oh my God. So many people are interested. Very good. So today we will discuss why it is important, what is it that psychologists and psychiatrists do, and if you want to become one, what is it that you are supposed to do? So from what I understand, all of you are in ninth to 12th grade. So you are all yet to enter your specialty subject in the college. I want you all to understand what psychology is, why is it important? Okay, let's talk first about why it is important to understand mental health, to understand psychology, to understand mind, right? It is the study of mind, right? I will tell you a story. I do not know if they tell this story anymore to you in school. It was a story in our schools. So the story is like this, and at the end of the story, I will ask you a question. So you'll have to answer the question. Okay, ready to listen to the story? Story goes like this. There were two woodcutters. Okay, जो पेड़ काटते हैं. There were two woodcutters. Both were searching for a job. Now they did not have a guidance like you guys have, so they were confused how to get a job. So both friends found a guy, an employer who was giving a job, but there was only one vacancy. So the employer who was giving the job said, I will take your exam, I will take your test, and whoever passes the test will get the job. So what was the test? The employer gave both those people to one thick tree each. दोनों को एक मोटा मोटा पेड़ दे दिया, ठीक है? And then he gave a blunted axe, ऐसी कुल्हाड़ी जिसकी धार नहीं थी, a blunted axe to each of them. And then he said, go and start cutting your tree. Whoever cuts the tree first gets the job. So they were like, okay, it is very easy for us because this is our work, this is what we do. The first guy was very enthusiastic. He ran towards the tree and started cutting the tree. The second one thought a bit differently. What did he do? He first sharpened the axe and then he went to the tree and started cutting it. Now, can you tell me which one won the test? First one or second one? Who got the job? Can anybody tell me? Okay. Second guy, second guy. Okay. Okay. So most of you have said second guy. And it sounds very obvious. Why? Why is it obvious? Because the tool with which he had to cut the tree, the tool with which he was supposed to achieve his goal was up to the mark. To complete the task, the most important tool was the axe. That is why he could achieve the goal. Now you look at our lives. Whatever we want to achieve in our life, how do we achieve it? What is the most important organ that works for that? It is our brain. Why? Because whatever we learn, yeah, we memorize, it all happens through our brain. And so all the input happens in the brain. Where does all the processing happen? Again, the brain. Yeah, whatever information we gather, it is all processed in the brain, understood in the brain. And whatever output we want to give, or intelligence or productivity, the problems that we solve, the puzzles that we solve, all happens through our brain. So can we say that brain is most important tool that we have to achieve our goal? The way in this story, X was the most important tool to achieve his goal. Same way to achieve all the bigger goals in our life, to be happy, to be productive, to achieve success. What is the most important tool? Of course, there are many other things as well, but most important tool is what? Our brain. But in this world, so less number of people understand how to keep your brain healthy. how to keep the emotions and actions and thoughts and overall mind healthy and happy. Very few people understand that, right? So when they suffer, when they are going through bad emotions, when they're going through negative thoughts, when their actions are not good enough, when they're doing procrastination, when they are not achieving their goals, they might not know what to do about it. But now the world is becoming aware that whenever this kind of a problem happens, who should we go to? An expert of brain, or let's say an expert of mind. Is that true? Right. So, in a way, psychology and psychiatry is the study of brain and mind and the functions of brain and mind. Is that true? Yes. So, this is why this field is very, very important. And I, as a psychiatrist, can give you this guarantee that when people come to us with problems, and when the study of psychology and psychiatry that we have done, it it helps us, it makes us so strong in our subject that we can help them to improve their life. It feels amazing when we know the science and art of the brain. It feels amazing to live our life and to help other people to improve their lives. You might see a lot of motivational speakers and all, right? Even you might be seeing their videos whenever you feel low. You might be seeing their videos on YouTube, and it might feel good for a while, but it might not be a long lasting solution, right? So when a trained mental health professional like a psychiatrist or a psychologist helps with a perfect tool which is exactly made for you, imagine how the life would be amazing, है ना? So this is why I want you all to think about this career as well, to become a psychologist or a psychiatrist. And there are many other diversions, many other subjects inside this subject as well. So if somebody is a psychologist, let's say somebody has done a bachelor in psychology, we will discuss how one can become a psychologist. And then we want to do masters. Masters can be done in clinical psychology as well, counseling psychology, sports psychology, forensic psychology, industrial and organizational psychology. We will talk about what these different fields are. But then there are so many different fields inside this field, and every different field is fantastic, very, very interesting. So how many of you have at least thoda bahut, at least a little interest in psychology and psychiatry? Can you all tell me? Say I in the chat. Okay, 1, 2, 3, 4, 5. Wow, a lot of people are interested in this field. Okay. So let's discuss how to become a psychologist and psychiatrist. And then I will also tell you how they earn, what kind of job they do, what kind of life they have. Okay, interesting. Okay. So if you want to become a psychologist or a first we have to discuss what is the difference between a psychologist and a psychiatrist. Very important topic, right? So first let's talk about a psychiatrist. I am a psychiatrist. So psychiatrist is a medical doctor. That means when we do MBBS after our 12th, we become a general practitioner doctor. Then we do masters, which is specialization. So in masters, there are many fields like surgery, gynecology, pediatrics, orthopedics, skin specialist, eye specialist, and so on, right? You know that. Same way, there is a field of psychiatry or psychological medicine. So when we do specialization, which is post-graduation in psychiatry, we become psychiatrist. So psychiatrists are doctors by default because they are doing psychiatry after MBBS, right? Is it clear? And who is a psychologist? Psychologist is not a medical doctor. They are still students of psychology, but they are not doctors before that. So if you do BA psychology or BSc psychology, you can become a psychologist through that. Then you have to do masters, MA or MSc in psychology. In MA also, you have all these different options to choose. As I said, industrial organizational psychology, in which you get a chance to work with different big companies and organizations and industries. It is very interesting. Sorry for my health today. Second is clinical psychology, in which all the mental health disorders like depression, anxiety, all that is dealt with, all that is treated. Then there is counseling psychology, in which different types of counseling are taught. Forensic psychology, which is all related to law, right? Criminal psychology you might be knowing, right? If you have watched any movies, when some criminal is caught and they want to understand their mind, um, they call a forensic psychologist to help them. So that is also very interesting. And the new branch which is emerging in India now is sports psychology. So if you know, जब हमारी ओलंपिक्स टीम जाती है ना ओलंपिक्स खेलने के लिए, so they also have a sports psychologist with them. They also go along with them, the whole team, even our cricket team and all. They also have a dedicated psychiatrist and a psychologist, because they have to keep their mind fit to perform the best, right? That is why they also have a psychologist and a psychiatrist with them. If you see any sports match, if somebody gets injured, a physiotherapist runs and goes to them, right, on the field. But when they're outside the field, outside the ground, and they have a psychological challenge, they are not confident enough, they're not understanding the strategy, sports psychologist helps them. So all these are different, very interesting sub fields of psychology or super specialties of psychology. If after becoming a psychiatrist, if we want to do further super specialty, even psychiatry has more branches, like de-addiction psychology, de-addiction psychiatry. All of you know what is addiction? Right? So many people have addictions, right? So how to stop the addiction is something a psychiatrist knows. So psychiatrists, after becoming a super specialist, can treat all kinds of addictions. Same way for child psychiatry, for old age psychiatry, all the different types of subfields in psychiatries are also there. So if you're interested in all this, if you watch any American TV series and all that, where big companies are there and all that, you will see some advisors which are giving some advices to CEOs and all that. So some of these advisors are psychologists, industrial organizational psychologists, right? You might be seeing a lot of therapists as well. If somebody is sad, somebody is not feeling well, they will sit on a chair, somebody else is sitting on the front chair, they're helping them to come out of their emotions. They are also psychiatrists or psychologists. Psychiatrists can prescribe medicines for brain health. Psychologists cannot do that. That is a big difference. Otherwise, all the other differences are minor differences between both. Any other questions so far? Okay, I think we can keep all the questions at the end. Tab tak I will tell you about all these fields. Okay. Now, who here wants to know more about what do psychologists and psychiatrists do in their day? How is their life? How do they feel? What do they do? Who wants to know? Can you write in the chat? I. Oh, somebody has said phone addiction is also an addiction. That is true. Me. Okay, very good. So let's talk about a psychiatrist. So have you seen a doctor? How many of you have gone to a doctor? Raise your hands. डॉक्टर के पास तो हम सब गए ना कभी तो आपको पता है डॉक्टर्स कैसी मस्त बड़ी chamber में बैठते हैं, right? Doctors have their own clinics and own chambers. Oh, so many hands. Very good. Thank you. You can put your hands down. So when we go to a doctor, we know how their life is, right? A doctor opens their clinic, or they might be working in a hospital where they have their own chamber, where they are sitting, and one by one, people come, patients come, they sit in front of them. Now, in wherever you have gone to doctor, maybe pediatrician or a physician, they spend hardly 5-10 minutes with you, right? But psychiatrists spend a lot more time. They ask you a lot of things. Yeah. So chamber means cabin. Somebody is asking, sir, what is chamber? Chamber means their cabin, doctor's room. Okay. So doctor's room has the table, chair, and all that. Psychiatrists ask you about a lot of things. How you think, how you feel, what is happening to you, everything in detail. You can talk about everything to a psychiatrist. Then they have studied scientifically how to understand the problem. So we as psychiatrists, we ask a lot of questions, we hear them out, we identify a lot of what are the exact problems in them and what are the exact solutions, and then we talk about solutions. So they learn the solutions, we give some homework. Sometimes we also need to give some medicines. They take it, they go home, they come here next week or 10 days or 20 days later. Then you ask them, did they do the homework? Did you take the medicines? And then they tell us the feedback, how they are feeling. Are they feeling better? Are they feeling happier? Is their problem solved? Do they need to know more? So they talk to us.